Are we gonna play our twinkle game? Shake, 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 shake along with me.
Music can often be such a big motivator for kids.
We know that music can make it easier for children to undergo painful procedures.
Everybody clap and everybody sing, la 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 la.
He just changes, he just relaxes. To have that 2 or 3 times a week, it means so much to us.
Goodbye, Evie. Goodbye,
Here at the Children's Hospital, music therapy is an important discipline that works as a part of the team that care for children.
A big part of the music therapy role in the hospital is to maximise quality of care while providing emotional support, health and wellbeing for our patients and families.
Oh, what fun it is to shake on such a beautiful day. Hey.
There are a number of benefits to the parents. Obviously, parents, brothers and sisters and the patient themselves experience a lot of suffering and pain when they're dealing with serious illnesses. And we find that music can actually change the table on that and I guess introduce an element of joy into the care that we provide.
Well done, Ezekiel.
Not only was the music able to reduce distressing symptoms, but the families were able to describe a sense of joy from being able to interact with their children around music.
We see a broad range of patients from burns to oncology to respiratory rehabilitation, as well as working in emergency department as well. We engage with patients using evidence-based practice to meet their clinical goals. But we all know
My son Harry's 13 years of age. We've been in hospital since April, so it's about 4.5 months now, and this is his longest hospital stay. It's a complicated genetic disorder where 180 sort of clinical symptoms can be associated with that, so it's a very broad sort of spectrum. It's nice for him to have something that he looks forward to, that he gets enjoyment from, that's a break from the clinical day, and yeah, he just really responds to it. It's amazing.
Good girl. We do some shaking.
We have an increasing evidence base around the benefits of music therapy. For example, in the emergency department, if a patient has a music therapist, they can provide a distraction and a way of allowing the child to express themselves while they're having a procedure done, and that can reduce the pain and distress that the child and the rest of the family may experience.
Music therapy aligns with other clinical services in the hospital, for example, other allied health specialists from speech pathology, occupational therapy and physiotherapy. They're round and they're shiny and they're quiet when they pop. With bubs and young kids, a lot of that's around developmental stimulation. Hello, Henry, and how are you today? How are you doing today, Henry? Woohoo! Well done. Some of our older kids, we look at emotional support and helping them cope the best they can while they're in hospital.
Instead of comforting him through so many painful procedures and different things, we're actually enjoying a moment with him in this environment. It's the one thing that he loves.
I'd love to see music therapy grow as a service within this hospital so that it can touch the lives of more and more patients in all areas and departments of the hospital.
Goodbye, Mia. Goodbye, goodbye, goodbye. We wave bye? You say bye. Where's your wave?